It's really important that we listen to what a client not only wants, but what his or her experience has been, and help tailor, create a plan that fits with that. So I try to kind of unravel all of the pressures and focus in on what your purpose is, what your passions are, and how we can just build those little steps towards getting there.
Evidence-based treatment is essentially a fancy clinical term for these are the things that we know are effective. These are the things we know work. We really believe strongly in providing evidence-based treatment because it's really a great framework for giving clients the tools and skills they need in order to thrive. You know, at Launch Centers, we work with what we call dual diagnosis clients. So we work with clients who are struggling with both mental health and addiction. Not all of our clients come through the door struggling with addiction. A lot of them do, but we can certainly work with clients who just have primary mental health and no addiction present. And so one of the modalities that we offer here is called the Matrix model, and it's an evidence-based treatment for addiction. And so it really helps clients to understand your emotions. It helps clients to understand, the thoughts that are involved, how cravings work inside the body, how triggers work. So it can be a helpful addition to people who are also attending 12-step meetings. But that's something that we believe very strongly about, that people should have options when it comes to addiction treatment. CBT stands for Cognitive Behavioral Therapy, and CBT can be a really amazing treatment. It has been around for a really long time. It is absolutely the most evidence-based treatment for depression. So we know it is incredibly helpful in helping people to lift their mood and to decrease depressive symptoms. And so it gives a really amazing framework for people to be able to redirect their thoughts to be more, not just positive, but more truthful. And it also helps us to understand our behavior and how our behavior is connected to how we feel.
I really love acceptance and commitment therapy. What that is, the acceptance part, kind of embracing that life has lots of ups and downs, and it's how we cope with those emotions and how we move forward and know that the bad times end and also the good times end. The commitment piece of that is commitment to values. I have clients write out their values, rank their values, and throughout therapy, we look to see if we're living in accordance to our values, finding out what their values are and how to take that next indicated action to live in accordance with those. So the other modality that I really like to lean into is narrative therapy, and that's all about helping clients claim their narrative. A lot of times they come in feeling a lot of shame around their addiction or mental health issues, and it's helping them love their story and who it is making them. So they are their own human, they have their own identities, and these symptoms are just something that they're learning to live with or learning to heal from.
We offer a modality called motivational enhancement therapy. We also utilize motivational interviewing that works with people where they're at, exactly where they're at. So we want to meet people where they're at and help them explore what they really want. We help them to work through their motivation, and often people might come in not really wanting to be sober, and they find a couple weeks later that they change their mind. So we want to work with clients at every stage in that process, and we want to meet them where they're at and help them move towards decisions that are ultimately going to benefit their life, whatever that looks like for them.
One of my favorite modalities is psychodrama. You are in control of it. You decide who you're interacting with. You decide how deep you want to go with it. It's just having them be able to talk to each other that way without sitting in the awkwardness. You're putting everything on the table.
I'm often interested in sort of the unconscious and the sort of the internal conflicts that people are struggling with that they don't really realize. Because some of our clients are a lot closer to their childhood than older clients would be, sometimes they have more access to those memories and those experiences, and can sort of develop a narrative around them that can be really beneficial into understanding why they're behaving in the ways that they're behaving in the present, and how they can start to begin to change that. A lot of psychodynamic and attachment theory is also brings to light, how we operated in our primary care relationships, and how those relationships are affecting our current interpersonal relationships.
So at Launch Centers, we offer medication-assisted treatment, and this has been something that I've seen sort of shift in the addiction field over the last decade, that there's really been some amazing medication that's been developed that can be so helpful for people who are struggling with addiction. So I know people get a little bit scared of it. They might think like, oh, I don't want to be addicted to something new, when in all reality, I like to think of it as medication similar to if somebody had diabetes, you wouldn't shame them for taking their insulin. And so I think of medication-assisted treatment as essentially being that, right? You're helping yourself maintain a functioning life.
So what these medications do is they subdue cravings, they make it to where a substance is not enjoyable like it maybe used to be or once was, so it makes it easier to quit. So really we're trying to cut some of the ties to the drug in a physical way, while at the same time really focusing on that emotional, mental work.
We have such deep care and respect for our clients and the work we do that I am just really grateful to be a part of this team. When I see clients that are often very broken when they come in here and do not have a lot of hope about their future, everything I do is about their future and about helping our clients find hope and seeing that they're so much stronger and so much better and so much more driven than they thought they were when they came in. So to see where they go from when they come and they start with us to where they go when we just send them off into the world is why I do this.